Everybody, welcome to my COVID-19 town hall with Regina Petteway from Wake County Human Services, and we're really delighted to have her here today. We want to thank all of you for attending, and this is my series of virtual town halls I'm doing as we're dealing with this pandemic. I'm changing the way that I'm interacting with my constituents in Morrisville and around the county with virtual town hall meetings. And this will also be aired on Radio Murchie. We want to thank Radio Murchie for being our partner to bring this on the radio on Sunday, and we'll be sending you all that information as well. So once again, I hope everyone is staying safe out there, and I want a chance now to welcome Regina Petteway to our town hall meeting. Regina, thank you for being with us.
Oh, you're welcome. I'm honored.
So I'm going to just let you begin and just tell the audience, the attendees, a little bit about your role in Wake County, and then we're going to dive into COVID. But I want to get your perspective of where we are today from where we were when we had you in the radio about 5 weeks ago, and as we get ready to reopen North Carolina in phase 1. What are your thoughts out there? Just a lot of anxiety out there, a lot of unknowns, uncertainty, and we want to hear from someone who's really got their feet on the ground. And we want to thank David Ellis, Chairman Ford, the commissioners, and the entire staff of Wake County for really being a foundation and a pillar of strength for us during this time. So thank you.
You're welcome. So my name is Regina Petteway, and I am your County Human Services Director. That means that both public health and social services are in my department. And particularly for this COVID-19 response, I work hand in hand with our emergency operations staff, and between my department responsible for the public health response, the testing and tracing, and some of the communications, it's a whole county-wide government response. And so we're pulling in all the departments in Wake County government to fight this virus. But my role is basically as your public health director and directing the public health response.
Okay. So even though this is a town hall, we're also going to be on radio, so I'm going to be asking you some questions, and you can chime in if you think there's anything that I've missed. So talk to us a little bit about, this pandemic has just taken thousands of lives in the United States, many in North Carolina. Where are we today compared to where we were 5 weeks ago in terms of number of cases, and is the spread slowing down in this county, in the state?
Okay, so I want to start with one of the questions you sent me, which is, how are we doing in Wake County compared to other hotspots? Yeah. And I need to start out by saying that every county is unique. There are differences in population, such as, how much of your county is urban versus low density, and in your health care resources. So there are two things in particular to know about Wake County that make us kind of special. We started our stay-at-home order before the state's order was in place, but a day after Mecklenburg's. And you also should know that we are the healthiest county in the state according to the Robert Wood Johnson Health Rankings. So that just means we have more resources, we have more hospitals and healthcare resources, but also our citizens are healthier in many ways, and so is our environment. So having said that, I'd like to talk a little bit about how we compare to a couple other counties. This is data from 2 days ago from the North Carolina Department of Health and Human Services dashboard, and you can all find that on the North Carolina Department of Health and Human Services website. So if we compare ourselves in number of positive cases to Durham County, right beside us, 2 days ago, Durham had 807 positive cases, and Wake County, much larger, more urban, had 961. But then when you compare that to Mecklenburg County, which is comparable in number of people in size to us, they had 1,922. So Wake County, 961, Mecklenburg, 1,900. Similarly, if you look at number of deaths recorded, Durham County 2 days ago had 29, Wake had 21, and Mecklenburg had 58. And so you can see that just small differences in demographic makeup, in urban versus rural in your county, and in healthcare resources makes a difference. However, for us, I firmly believe that our strict stay-at-home order and how people paid attention and complied with that has really helped us flatten our curve. And we have done that. We have flattened our curve. We have slowed the speed in which the number of positive cases increase. However, I do need to say we're not at our peak yet. And we still have to pay attention to our healthcare system's capacity to handle sick people, availability of personal protective equipment, and also people continuing to comply with stay at home until we can start opening up again.
Sorry, that's good to know. And I mean, so the cases are still increasing. The good news is that, as the governor said, you know, our hospitals do have beds, we do have ventilators, we are getting better at personal protective equipment, which is one of the questions I was going to ask you, but we still have not reached the peak yet. And I think that's very important. So that's a good segue into my next question. So we're slated to reopen tomorrow at 5 o'clock. The phase 1 begins. It's really a modified stay-at-home order. So Wake County amended your stay-at-home order to comply with the governor's order, along with Morrisville and all the cities in our county. So what does that mean if the cases are still going up? And I'm getting some tweets coming in. People are concerned about, well, then can we open too fast? And it's just sort of this unknown. I mean, even for me, do I go to an essential store? Do I not go to an essential store? Do I wear a mask, which isn't really required by law, but we're hearing CDC guidelines. So what is your take on that as we go into phase 1 of the reopening?
Well, as you said, phase 1 is a moderate reopening. And you're right, there were several criteria for reopening, and we have not met all of them. In fact, we just met one of them. I would say, as your health director, continue to be as conservative as you can afford to be. As you know, this is a fine balance between protecting the health of the public and what this is doing to devastate our economy. However, I'm your public health professional. The health and well-being of our residents and protecting them from death and disability comes first for me. You can recover eventually on the economic side. It's going to be very hard, but we need to protect people from actual death and disability. So I would say, as we open up, continue to have that conservative approach. If you don't have to go out, don't go out. The governor wants you to go out to exercise. Yes, do that, but keep your social distance. I know you've seen pictures and you may have been on some of our greenways, and they've been really crowded. If you have any sort of health compromise condition, or if you are 65 and older, I would advise you to continue staying at home. As our businesses and our faith communities open up, continue to ask those people who have health compromised conditions or who are 65 plus to stay at home for a little while longer. Now, those are my recommendations to you, and that is because, number one, there's no vaccine for this virus, and it is still spreading. And I was looking at a few statistics by age, and I think one of your questions was, should young people be concerned about this? And I think young people are going to be the first ones to want to get out there and get active. You should know, in North Carolina, for the age group 25 to 49 years old, they represent 42% of the cases in the state. And, you know, most people would think, oh, it's older people that get it. So young people in that age bracket represent 42% of the cases, but only 3% of the deaths. So they get it, they contract it, but they recover. When you look at 65-year-olds, they represent only 22% of the cases, but 86% of the deaths.
Wow, that's very interesting.
Fewer older folks like me get it, but they represent 86% of people who die from it.
Wow. Now and so phase one, phase one is basically a modified stay-at-home order. Still basically it's saying, you know, all businesses can open, but we have social distancing, gatherings are limited to 10, churches can start worshiping, but they're still, you know, so it's just a phased approach. And then the governor says that you've got to hit these benchmarks, which is about hospitalizations leveling out, the number of positive cases. What are those benchmarks? And the reason I say that, it's important for people listening to the show, because we're seeing protests out there, people saying open, open, open. Just because the governor says that phase two could begin in 22nd of May doesn't mean that it could begin. If we don't hit the benchmarks, we could have to tweak it, change it.
Correct. And you really have to look at it. I know that you have people who are listening or looking at this who don't live in Wake County. So you really have to get an assessment of how it is around you. But what I can tell you is some of the criteria. For example, one of the criteria is a decrease in COVID-like illnesses. So that means things like COVID-19 and the flu. That is one of the indicators that is good. It's going down. And so the state and the county have achieved that. Another criteria is a decrease in the number of lab positive cases. Neither the state or the county have seen that. Also, we have not seen a decrease in the percentage of positive cases out of all the people who were tested. So although there is a slight decrease in some areas, it's still going up and down. And so Mandy Cohen, our state DHS director, has said that that's still a no for us in terms of positive direction. We also look at a decrease in hospitalizations for the last 14 days. The state has not seen that, but the good news is there is a slight decrease for Wake County. Now, as we start doing more testing, that could go up again, and we have to watch it over 14 days. And still, we do not have enough testing capability. We are building that, or PPE, personal protective equipment for our priority workers. Now, also, I need to say, as we open up as a county, think about it. We are still getting enough protective equipment for emergency responders and healthcare workers, child welfare workers, etc. We're going to have to find even more as these businesses open up, because their employees are going to need gloves, they're going to need face coverings and masks. So that is still a problem area for us. But pretty much those are the criteria that the state looks at and that we as a county are looking at.
Okay, and your counterparts in other counties are looking at those standards as well. Is it true that, so one confusion is asymptomatic. So I could, and I think I was talking to my wife who's a doctor and my father who's a retired surgeon, but I could be carrying the virus and not have any symptoms, correct?
Correct. You could absolutely have no symptoms.
Okay.
And I'll give you an example of that. My daughter, who works at UNC hospitals in Chapel Hill, has an occupational therapist classmate who works in Texas in a nursing home. And so they had an outbreak in that nursing home with the residents. So they tested everybody in the nursing home. She works there. She had absolutely no symptoms. She tested positive. And so, yes, you can be carrying the virus enough to be contagious and still test positive.
And that's why if you're not washing your hands, and you touch something, the droplets could stay in the air, or you touch your face, it's a very contagious virus, which is why we're focusing so much on staying at home. And the 3 W's that Secretary Cohen said: wash, wear your mask, wash your hands thoroughly in sanitizer, and then wait if you're in line 6 feet away. So the three W's. And then
Yeah.
Governor Cooper has the 3 T's, which is testing, tracing, and trends. So you hit on one of the challenges. We're doing well with tests, but still we need to test more.
We absolutely need to test more. We're doing better than we were doing a month ago, but I would still say we are building our testing capability. We need to test over 1,000 people a day here.
Okay, all right. And then a couple more questions before we open it up. In terms of PPE equipment, N95 mask, gloves, I know that I introduced you to a business leader that's helping me. There's a lot of other, and you're going to help guide him in Wake County. We've got others that are doing stuff like Chinese American Friendship Association, BAPS, a lot of nonprofits, groups are coming in and helping. How can we get more PPE equipment? What can we be doing as businesses and citizens to help us do that?
So as a county, with our response, we work through our Emergency Operations Center. They do the purchasing and procurement. They work with the state on getting PPE that comes down from the feds and the state. And so that is the main contact for the county. And, you know, if they want to, they can give me a call and I can connect them with the Emergency Operations Center, especially if they are a verified source of PPE, you know, without the prices being escalated so high that we can't afford them. I think the other capability we need to put in place is we need a hub where small businesses, faith communities, and others can call directly to get validated sources for them to get PPE. So in addition to government, we're going to need a source for our businesses as they begin to prepare to open.
Okay, up. So like a supply hub, like a hub that they get. Okay, that's good to know. And then there is concerns about younger children getting it, which is alarming. I've been watching the news about, you know, young kids getting it, but we just have to make sure that they, you know, rest and stay healthy. And while we try to find a vaccine, and that's my last question before I open it up. So we have in North Carolina, actually in Morrisville, we've had, you know, Biomedomics, Key Biologics developing COVID-19 kits, BioChrist, which is an RTP-based company working on antiviral, LabCorp that's working on some stuff. And then you've got obviously Gilead in California with Remdesivir, Pfizer. Every day it seems like there's innovation taking place in the vaccine, the research. You still think we're a year away from having a vaccine? Maybe not longer?
I'm hopeful based on what you said.
You are, okay.
That we are not. I really am hopeful for that. The thing that we have to do is get a chance to test what they are developing to make sure that vaccine is giving you a good enough picture of a person's COVID status. And then so that once you get the vaccine, you got to know that it tests enough positives and it's accurate for that, and that you're not getting false positives and false negatives. So that's some of what the developers are looking at now. But we have so many reputable pharmaceutical companies and other folks developing a vaccine. I'm hopeful that by the fall, we will start seeing some sort of vaccine, but we still don't know because they have to test it and make sure it works.
Now there's talk about it coming back again, possibly in the winter time, right? If it did, we would hopefully be more prepared for it to deal with it in the country, in North Carolina. We just have to hope. Right.
So we can hope for that, but we need to prepare for the worst. So number one, it is not going away in the summer. I don't care if people tell you, you know, UV light kills it. It's not going away.
That's what I was about to ask.
It may ramp back up in the fall as students go back to school and we begin getting closer together again. The problem with that is we still don't know again if we'll have a vaccine for that. We don't know if people develop enough immunity to not get it twice. And so we may see a spike in the fall and the winter again. And that is with the fact that that is flu season. So that's why the state is tracking COVID-like illnesses. And what we expect to see in the fall is the usual, and winter is the usual increase in flu, as well as a possible increase in COVID-19. But the good thing is you can get a flu shot. So tell people not to be so focused on COVID-19 come the fall that they forget about getting their flu shot.
Yeah, make sure you get your flu shot. And just, I mean, it's just, so living, before we open up for questions, living in a perfect world, a year from now, and we didn't really get into phase 2 and phase 3, but those are just, you know, we hit the benchmarks, we go into phase 2, and then eventually all the businesses would be opening up, but it's more of a gradual approach. And it may not be the normal that we know about it. It may be common for us to wear masks to go into public places. We don't know when people will be comfortable going to a movie theater. I like to go to DPAC to watch a show. When is that going to happen? There's just a lot of uncertainty, which I think is feeding into the anxiety. After a few months, all we can do is take it one day at a time. But a year from now, 1 year from now, where do you think we could be? I mean, by then we could have a vaccine that's going to go in certain. Do you think we could be closer to a normal than we thought a year from now?
I don't think we're ever going to go back to normal, because
Okay.
this has really put fear into our society. And I think it's going to change us to a new normal. But I am hopeful that a year from now we'll have a vaccine. And ideally, Wake County and the state should be bouncing back from this virus a year from now.
Okay.
I hope students will be back in school and the economy will start to recover from this strain. And I hope our global experts will have a better understanding of COVID-19 so that they can help us understand how to arm ourselves for a second wave. But I think we're still going to be watching this virus a year from now.
And then for me, and I'm going to open up for questions, we're seeing, you know, like what's going to happen with, you know, conferences, business conferences, technology conferences, so many different areas in business development and even elected leaders getting together. Is it going to be like this, where it's all going to be virtual? I mean, that's, you know, how are they going to make money and survive? Chambers, I mean, there's just so many questions. It's like I'm living in a sci-fi movie right now, unfortunately, where it just never thought that we would be seeing these kinds of times. You've been so helpful. We're going to open it up for questions. I had one just come in. What is the website for Wake County COVID-19 data? Open data, like is there an open data portal where they can go get all of this?
Yes. So if you go to www.wakegov.com, that's www.wakegov.com. You'll see the big COVID-19 scroller at the top. You click on that, and then it will take you directly to where you see the dashboard with our Wake County statistics. And it also links you to the state dashboard where you can look at a map by zip code, compare number of state and county level data.
We had some internet issues with you, but I think we can hear you. Can you hear us now? We lost you there for the internet, but I think we got you. It's weird. Okay, thank you.
Okay.
Yeah, thank you. The other question I got in, and I can take this question, someone just texted about the small businesses and how hard it is for them to survive. What I can tell you is that Wake County commissioners did approve, and it'll be approved by in another week or two, but a $5 million program of small business assistance, which would be managed by a third party. And that businesses get up to $50,000 of, it would be more of a loan, not a grant. And then other cities like Raleigh and Apex are doing it. We're working on something in Morrisville, and we also have, other cities in Mecklenburg County is doing that. So we're just going to have to continue to work. In addition, those programs are in addition to the federal monies where you can get emergency disaster relief funding, or you can apply for a PPP, Paycheck Protection Program, which guarantees 75% of whatever the money that you get is forgivable as long as it's used for payroll expense and those kinds of things. So we're going to do a separate seminar again with John Loyak and Tom Stiff for the business community. But Regina, we got one question about the North Carolina website says there's 0 days on hand for gowns. Someone noticed that. Is that something that we need help in?
Absolutely. And what they look at is what that looks like across the state. So Wake County may have a bit more of a cushion for that, but not much. So gowns would definitely be a need.
Okay, 0.
Yeah.
Yeah, okay. And it says that the website also shows their estimated days of PPE on hand is at least 31 days. So 31 days on hand for N95 respirators. So once again, that's just what we need to work on in terms of just getting more of those supplies and maybe having a hub, correct?
Correct. And the other thing to look at on that website, you can see the number of hospital beds available. And I believe you can see the number of intensive care unit beds available. So that's something else that we are watching, and that varies by county. But right now, most counties seem to be okay with that. Some counties have more cushion than others.
Okay, all right. You've given us so much information. I mean, you really are a walking encyclopedia. I could have you here for another hour and a half. I mean, just because to me, it's been really informative to hear this. And I think, are there any other questions that does anyone have? And if not, you can email me and I'll connect you to Regina, and we can always, how do people get a hold of you?
You can actually call my office and someone will answer the phone. You can call me at 919-212-7759. And you can also email me at rpetteway@wakegov.com.
Okay.
And
I
I
just
would
have 2 more. Go ahead. Sorry. Go ahead.
I just would like to say thank you so much to everybody for complying with our stay-at-home order. We can actually track data that shows if people are staying at home or not. And Wake County is doing a really good job of staying at home for the most part. And so if you could continue to encourage people to do that as much as possible, it's really going to help us. But I really appreciate you doing that. And I appreciate, Steve, people like you who help us get the word out about how we can make a difference. And this community has made a difference and is helping to flatten that curve for Wake County.
Well, that's great. We had 2 more questions come in. You're just, there are people wanting to ask questions. This is really good. It says, does Wake County show estimated days left of PPE, or does North Carolina show estimated days of PPE on hand inventory? I'm assuming they do.
Yeah.
Okay.
Well, and that is something that you may not see statistics on from day to day, but it is definitely tracked in at the state level, and every county through their emergency operations center tracks that with our hospitals and providers. So not only do they know what the county needs, they know what our hospitals and providers need also.
I got another final question that came in, and it's just about technology and data. There was recently an article by Fareed Zakaria on Estonia and how much they're using data and technology for things like artificial intelligence, virtual chat. And even in North Carolina, here we have Internet of Things, NC Riot's doing an event in about 30 minutes. But I think if you're an entrepreneur and you have an idea, we have a very innovative county. I would reach out to Bill Greaves. He's our Chief Innovation Officer. And Wake County's been doing some stuff. They have an open data portal. They are providing data sets. So I would just say reach out with the idea. And, if you're a we are the 3rd fastest growing tech economy in the country. And a lot of it is in Wake County and in the Research Triangle. So, as someone in the tech industry, I think it's a great opportunity to roll your sleeves up if you have an idea and just reach out to Wake County.
Absolutely.
Bill will take a meeting, and he's a very innovative, out-of-the-box thinker. His team runs IT for Wake County, but IT in his role as innovation officer is different than just the servers on and do I have enough computers, and am I getting the antivirus software, but also from data and analytics and those kinds of things. So we'll probably bring him on as well to talk about that. But we really want to thank everyone for attending, and we look forward to catching up with you again in a couple weeks as we get out of
Okay.
this phase. And we want to wish you and Darshan Patel and the whole team out there all the best. And want to thank my team for working with me so that I can do this more frequently. And I just want to thank you. We're fighting a war. It's a war in our healthcare system. It's an economic war. And Surgeon General Adams said this is a Pearl Harbor moment. But the way wars are won are by heroes in the front lines. And the healthcare workers, the first responders, all of the leaders that are stepping forward, working around the clock to make sure that we're safe and that we can get back to some set of normal. So we want to thank you for being one of those heroes. Thank you.
Thank you.
Be safe out there and get some rest this weekend if you can.
Okay. And you all stay home if you can and stay safe and well. I appreciate you letting me be with you today.
Thank you. It's been a wonderful town hall, and this will be airing at 4 o'clock on Radio Mirchi, the South Asians, North Carolina's largest South Asian radio station. Thank you so much, and we'll be back next week for another town hall meeting. Thank you, Regina.
You're welcome.